Hey there, welcome to Up in the Cloud, future-proofing healthcare data with Redox and Productive Edge. My name's Mike Moore. I'm the VP of Partnerships at Productive Edge, and joining me is Cal Harris.
Hey there, I'm Cal Harris, Channel Director here at Redox. Thanks, Mike, and the Productive Edge team for having us on and being a part of this collaboration.
Yeah, absolutely. And we're going to talk about cloud data. So we'll go through our introductions, obviously, that we just did. We'll talk about some of the challenges that exist, some of those benefits of the cloud, and some of the sensitivities around moving healthcare data into the cloud that you and the team at Redox work with every single day. We'll talk about how Productive Edge helps work with customers and kind of how we get there, and then we'll close things out. So let's start off with some data. I always like to see what McKinsey and some of the other analysts who are out there and consultants out in the market have to say. McKinsey did a study and they see a $1 trillion prize up for grabs is kind of the article that we grabbed this from. And specifically for healthcare, 100 billion to 170 billion in 2030 for healthcare companies based on leveraging cloud capabilities. Now, it's not as simple as just move everything to the cloud and then life is grand and you're making so much money and all the problems in healthcare are fixed. It's a balance between digitizing and kind of moving some of the cloud, taking advantage of cloud infrastructure and some of the benefits that are there, but also driving innovation. We've seen in the last year this transformative effect and the impact of AI on so many things that we do in our daily lives. For many of us who, at least in the tech industry, maybe we're kind of stuck in our own bubble, but nearly every healthcare organization that we speak to on a daily basis has some notion of an AI pilot or something around innovation. And really, that's a great opportunity for all of us. So, can we achieve some cost savings by moving to the cloud? Can we innovate? Can we accelerate the pace of innovation? Can we digitize some of our processes? Can we reduce and eliminate waste? Is really a key driver for many organizations. Another McKinsey report that I saw that I really liked looked again at the healthcare specific opportunities with cloud technology and looked at these 5 areas that you see across the top around personalized experience, medical management, member acquisition, value-based care, and home health, and these 2 key enablers underneath of omni-channel engagement and longitudinal data mining as kind of key supporting pieces. For the Productive Edge perspective on this, we look at it and say, most of the organizations that we work with on both the payer and provider side of the industry have one or several of those top 5 issues that they are going after. Just as an example, many of those who are in the payer space look at member acquisition and specifically around Medicare Advantage as a key driver. It's in many of their annual reports that are being issued this year here in 2023. We want to look at how we support them with technology opportunities to go drive against that. And the cloud is a key piece of that for many. Of course, foundational layer to all of this is data. And that's obviously why we're here, is to talk about how the cloud and the data layer of this really becomes the unlock, the secret to kind of making all these experiences happen. So one of the things that we do all the time in talking with customers and whether it's doing workshops or other engagements is look at some of the key questions that they ask and really think about how do we thoughtfully respond and provide guidance and recommendations to them. So many of the things that we hear is, where do we begin, right? If we're not really committed to a full-blown data initiative for the cloud, is there something we can do to start to dip our toe in the water, become experienced with it, understand some of the issues? What should we focus on first and why? How should we plan to do this securely? I mean, compliance and healthcare data is obviously a huge issue. We see so many data privacy issues that happen across all industries. You probably get the notifications, Cal, just like I do, from consumer products and services we use, like, oops, we're sorry, we were hacked and your data's been leaked, and here's some free credit monitoring, right? That's unacceptable in the consumer world. It's even more unacceptable in the world of healthcare. And obviously, there's some legislative backing to that. So no one wants to be on the front page of the New York Times, Wall Street Journal, or pick the publication with a healthcare data privacy leak. How do we balance responding to innovation and regulation effectively, right? So there's so many issues afoot. Why don't you take us through a bit of what Redox does to help healthcare customers with some of these issues and really answer some of these questions?
Yeah, I think that's a great way to set the stage. And I'll go into the background of Redox here in a second. But there's this foundational question that comes up all the time when we talk to our cloud partners and across a multitude of engagements with providers, payers, and life science orgs, large and small. There exists this foundational question that really comes up early on when evaluating the potential for all of these use cases that we're referring to, and that question is, how will we get the right data into the cloud? And to further expand a bit, how will we do so in a way that does not burden our overall strategy with outsized cost and resource drain, extend timelines, et cetera? So these are all really loaded questions, and every organization is going to have to unpack them to determine their own optimal path to securely and efficiently connect their source data, which typically is in their EHR, into their cloud environment, depending on what they actually want to do with that data. So unfortunately, though, for many of these groups, right, that have high hopes for the kind of insights and workflows they can unlock on top of their data, in order to cross the chasm and realize that vision, they've got to address a lot of potential unknowns as they go. This could be things like upfront and ongoing total cost of ownership of both the cloud solutions they want to leverage and the integration process to activate those as well. Things like testing, monitoring, troubleshooting for live connections. These can grow quickly in cost and complexity if you're just getting started on your own and don't really have a guide alongside you. Apart from cost, you've got to make sure there's the technical expertise either within your organization or adjacent your organization, such that accessing the right data and standing up an implementation doesn't drag out and really delay your timeline to a go live. Extremely important, as Mike has already mentioned, is ensuring all of this connectivity is done in a secure and compliant way that protects PHI and really maintains that high bar of trust. And after all of that, groups have to consider really the timing and prioritization of all of these pretty aspirational projects and weigh them against a laundry list of existing priorities and what are always kind of scarce resources within these groups. So if you go to the next slide, a great way, and the reason why we're here is a great way to address these fundamental questions is to use Redox. And Redox is the leading healthcare data integration and interoperability solution that sits between you and your cloud environment as really an elegant and efficient way to lay the pipes for data to flow from where it resides. Like I said, typically an EHR environment into whatever cloud application endpoints you might want to use. Of course, you'll notice on the right-hand side of this slide, we're not just limited to EHRs. Today, Redox is powering billions of transactions every month across a host of different data sources and data formats, including CDA, DICOM, X12, and of course, HL7 and FHIR. So if your gears are turning here, and I hope that they are, you'll notice there's a kind of component of reusability that starts to emerge and is really powerful when we're talking about the cloud and the cloud use cases. And that is, instead of tackling each connection one by one from all of these source systems, say if you've got multiple EHR instances across your healthcare network, with Redox, you get a single reusable infrastructure in place that makes each additional connection and integration much faster and smoother to implement. This is really key to efficiently realizing the value of your investments in the cloud because it gives your organization flexibility to really adapt as your priorities and use cases evolve over time. Obviously, very important to us, Redox is high trust certified and SOC 2 compliant as well, which we take super seriously for all of this data in transit. And there are lots of ways to really visualize how Redox enables connectivity between all of these boxes and lines. And we'll come back to this in a second. But another way to think about it, if you go to the next slide, so everything that you saw in that blue box in the center of the prior slide, if we pop the hood, this is really what Redox has built over the last decade in terms of functionality in our platform. There's a lot to dig into here for a technical audience, but I'd suggest screenshotting this slide if you're interested in that, because I'm not going to belabor all of the acronyms and bullets here. The important takeaway is that Redox has all of this pre-built. So again, this removes time and uncertainty from your particular integration or implementation because it's all already there. If you want to go to the next slide, a little background on Redox as a company and where we've got an existing footprint. As I mentioned, we're a leader in healthcare data integration. And today, Redox has live connections at over 5,600 hospitals and health systems across the country. We're the fifth largest care quality provider nationally, and we're connected to all 50 states' public health agencies. Our technical team has many former EHR engineers, and their familiarity with EHRs and EMRs extends beyond the usual suspects of Epic and Cerner and Allscripts and Meditech, but also well into the long tail of EHR vendors. So more than likely, we support whatever EHR you are on today. There's also an interactive map of all of these connections, at least those we're able to share publicly. If you visit explore.redoxengine.com, which is linked here. And I'd suggest you check that out to see if there's already some track laid somewhere within your organization or your account. Because again, I want to come back to this concept of reusable infrastructure and why it's so powerful when thinking about the cloud. So if you go to the next slide, Redox Nova is our cloud integration product. And it is specifically purpose-built to enable you to pump as much data as you want or need into your cloud environments, so that you can actually then flip the switch on all of these powerful tools and solutions that are coming to market as represented in our kind of simplistic blue box here on the left. And that's really where we've partnered with Productive Edge so that you can get a bird's eye view into the whole picture, right? From the data where it's at rest today to where it needs to reside within the cloud and the optimal path to connecting the two and the strategy built around that, which is really where Productive Edge shines. We're excited about the possibilities that customers are exploring today using our specific Nova adapters for several of the largest cloud service providers today. That includes Microsoft Azure, AWS, GCP, and Databricks. A couple of the most common use cases we're seeing are focused on, hydrating a data lake for the purpose of advanced analytics and other types of AI or ML solutions. Another one is establishing real-time bidirectional connectivity to power clinical workflows and patient engagement solutions. There's a lot more to unpack there in terms of what in-state solutions Redox can actually power with this data once it's in the cloud. But ultimately, again, that's where we've partnered with Productive Edge to help build the overall strategy around your priorities as an organization, and then roadmap the build to the right connectivity and integrations to support those. Mike, I'll let you jump back in here to tell everyone more about the accelerators, but I appreciate the time to walk through this.
Yeah, of course. And I think, what's exciting about what you and the team have done at Redox is you're creating that piece in the middle that does so much in terms of connectivity, because who knows what health systems you would need to connect to as a payer, who knows what payers you need to connect to. There's especially with so many health plans, and I'm just going through this with my own mother as she is in the open enrollment period for Medicare Advantage and trying to figure out, like, is she going to stay with the plan that she's on or move to a different one? And what is her one concern? Is my doctor covered, right? And that's the typical patient perspective. If you're on the provider or the payer side of it, it's not that simple as just looking for one connection, right? You're looking for hundreds or potentially thousands of connections, and the work that the team has done in investing in the engine and providing that as a resource to be able to connect not just to the healthcare ecosystem, but the public cloud providers. Many healthcare systems already have investments with Microsoft or Databricks or Google or AWS, like you've listed here, or Snowflake as well. So they're using a lot of those commercial software tools and platforms and want to be able to bring their data to it. They just need help getting there. So that's really the opportunity is how we get there, and that's where, as Cal indicated, Productive Edge partners with Redox. So a little bit about how we look at the world, and it's really not our worldview. It's much based on the work we do with customers. So as we talk to our customers in the healthcare ecosystem, a lot of them have one or several of these four pillars around outcome management, care delivery and care coordination, reducing the administrative burden of healthcare, and member or patient engagement and marketing as their top kind of issues. And so when we look at what's required to deliver on these experiences and outcomes that many customers are trying to drive, we know that there's a foundational technology stack, which is these 6 boxes that are in the center of the screen. So clinical interoperability, a modern cloud data platform, machine learning and generative AI, again, such a hot issue this year and will be for several years to come. Automation, so process automation is a key piece. A lot of workflows in healthcare could be optimized significantly. Cloud adoption overall, and then of course integrated CRM, and that ties back into what Cal mentioned around omni-channel experiences. So many of us as consumers, again, and patients and members, we want to have the same experience when we're on our phone, on a web browser, at the doctor's office, right? We want to have consistency in the information and have it be aware of who we are and our relationship with the organization. So how do you power all that? Obviously, data and having the connectivity is a key piece. So the way that we deliver that through Productive Edge, we're a healthcare-focused system integrator partner. We work on the strategy as well as the technology side of the issues. We have a set of services, really trying to empower healthcare teams, one service at a time. We have these accelerators. So the accelerators, the opportunity there is to really fast track having predictable outcomes, predictable costs, really jump starting your adoption of different technologies and making it very predictable and turnkey. Then, of course, we have software solutions where we've invested, and you can think of these almost as maybe a 75% of the IP is created. We've built a chat bot on multiple cloud platforms that we call Care Advisor, allows you to tap into your health data and use that for customizing patient experiences or even administrative workflows. You want to simplify things like prior authorization and the administrative review of those submissions. We have an AI experience that supports that. So there's so much to do around this, but having the key components in place is really important. When we look at it from a customer's point of view, this is how we usually map things out in those four pillars with that foundation layer, you know, kind of the foundation of the house in many ways you can think of it. And when we workshop this with you, we go through what are the priorities that you want to focus on and how do we light these boxes up. You see the color coding here. So we're looking at some that are relevant to payers, some for providers, some for both, and then what we feel are foundational capabilities for all. So it's really a personalized approach that we go through to figure out what are the key drivers for you in the coming year and years to come. How can we use cloud technology to help transform some of these processes? How can we help you save and reduce the administrative burden? How can we help you innovate and accelerate things like patient member engagement? So many opportunities. It's going to be different for everyone, but the framework really helps guide us and prioritize these experiences. So where do we go from there? As I mentioned, we have a strategy practice as well as design, implementation, support, analytics. So the process ends up unfolding as follows. We set out with some well-defined priorities. So let's not dive into the technology piece of it. Let's be thoughtful in our approach. Let's lay out the strategic objectives. Many of our payer customers, of course, right now are looking at the Medicare Advantage star ratings and how those are influencing consumer behavior is about to unfold, right? As the first star ratings are coming out, people start to react to that data, make buying decisions based on it in terms of which plans they're going to start with or maybe renew into a different plan. So it's a key metric for the industry. Everybody's looking at it. How do we use something like that or whatever the exact KPIs are for you? We want to understand that before we just dive in. Then mapping out the business and digital capabilities is so crucial. So much of what you do in a health system in the payer side of things is so cross-functional. We need to understand all the relevant pieces and how they're going to come together and how we drive the efficiency throughout the workflow or throughout the digital experience, whatever it might happen to be. So it gives us an opportunity to map that out, and then we can start to look at an iterative roadmap. Most organizations don't want to wait for the 2 to 3 year release. They want to have a minimally viable product, as it's known in the software industry, an MVP, as kind of a first version that releases, and then something that we can iterate and work on from there. And that's very much the approach that we take. We know that everyone has stakeholders, shareholders, a board, trustees, someone is looking at what we're doing and the investments we're making and want to make sure that we're learning from it and iterating and adding value quickly. And that approach really lends itself well to the initiatives we're talking about here today. Final piece of the cycle, of course, is maturity and execution. So as we continue to grow, as we continue to work through this, taking the learning into the next cycle and continuing to iterate and develop, planning not just for the launch of a new solution, but over time, how will we sustain the energy, the excitement, the engagement? How will we bring essentially the bar up higher and higher as we go? So this is the thoughtful approach that the team takes. Very experienced, a lot of healthcare domain expertise, and again, that's why we love partnering with Redox, because they're philosophically aligned and have that deep expertise in the industry, as Cal described. So how we execute, this is one example of kind of data-driven AI capabilities for an accelerator. So another process, right? So we're very process-driven, as you can probably tell at Productive Edge. When we do something like take on a data project or an AI project, these accelerators, as I mentioned earlier, are a key piece in helping us establish a framework for what we're going to do, execute in a very systemic way. We don't want to stifle innovation or creativity, but we also don't want to show up and say, the project isn't done yet, but the funding has run out. We need more money, right? So we want to make sure that we're all on the same page, have expectations aligned about what the deliverables are, get started, iterate, 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 right? And that's the key to the framework here. So discovery, then assessment, key findings, recommendations, and then execution. That's the basic components of what we do. Fixed price, rapid delivery, fixed time, predefined outcomes, lets you put a stake in the ground and know where you're going, and then be able to take things forward from there. So we apply this approach to what we're doing with Redox, specifically around moving health data to the cloud. And we've developed a healthcare data strategy accelerator. And so that takes the first three pieces and really handles that discovery, assessment, key findings, recommendations piece, and packages that up into one engagement. Then from there, you can go into an execution phase, or if you're already committed and know that's the direction you want to go, that would be the second accelerator, which is the data integration accelerator, where we'd actually build some of that execution into the acceleration of this project. So is different options here depending on kind of what you're ready for and how you might want to explore it. The nice part about how we deliver all of this is we've built out the entire framework, of course, based on reality and the work that we do together, so that we know we're going to have Redox and their team in and collaborating with us as we work with you. And so it's one piece of paper essentially to sign to get the accelerator. You're then going to be able to work with both of our teams. And then from there, you'll know, what do I need from Redox? What do I need from Productive Edge to make this real? Get the right licensing set up. If you want to get it through the Microsoft Azure Marketplace to buy your Redox licenses, use your Microsoft Azure commit, all those kind of opportunities are on the table. We want to make this super easy and frictionless for you. And we understand what it's like working with a lot of those cloud providers and the different contract structures. And again, want to make this as simple as possible for you to adopt it, not have to worry about the administrative side of things, be able to focus on the solutions and the impact for you. So that's a lot of what we've built into the accelerators and these solutions, what we're doing here. So just as we get towards the end and kind of close out here, Productive Edge has been around for 15 years. Redox, not a new company as well, doing new and innovative things, and I'd like to think we are as well. But I think our well-established roots in the industry help us do the things that we do. We're a U.S.-based company, specifically in Chicago. We have offices, Boston, Miami. We do have offshore teams in Poland and Ecuador. They do great work and help us really deliver around all of the experiences you see here, driving digital healthcare outcomes. All right, Cal, that was a mouthful, but in close, I think there's some great opportunities for healthcare customers in the cloud. The combination of Redox and Productive Edge. Obviously, we're biased. We fancy ourselves here and think, what we put together is great. But I do think that it really packages things up in a very easy way for customers to be able to adopt and start to realize some of that opportunity that we hit on in the beginning.
Yeah, and increasingly, I think you had it a couple of slides back where Redox is sort of embedded with alongside Productive Edge throughout the whole process, and we continue to hear, increasingly from our cloud partners in particular, that having a view of the connectivity, not waiting to delay that assessment till you're already running down a project or a use case. taking a view of that early on and strategically in the process is exactly what they want their customers to do. And so I'm excited for this to kick off.
Yeah, same here. Yeah, we hear it all the time. Like people say, like, love it, just need to kind of lay down the strategy before we go execute something. And the accelerators, I think, really do a great job helping to address that. So we look forward to hearing from you. If you want to reach out, certainly you can contact us individually or services@productiveedge.com. Love to hear from you, or contact your Productive Edge client director or your Redox account manager. We'd love to hear from you and talk to you more about what we're doing. So, Cal, thanks for your time today. Appreciate you stepping in and recording with us.
Yeah, absolutely. Thanks. You too, Mike.
Thanks.